If you have symptoms of sleep apnea like snoring, daytime sleepiness, and you're not sure if you're at risk of obstructive sleep apnea, today I'm going to be teaching you about a simple questionnaire that can help you assess your risk of sleep apnea. This questionnaire is called a stop bang questionnaire. Some of you may have heard about this, some of you this may be the first time. If you know about stop bang, I want you to still keep watching because you're going to learn something new today. Now, what is stop bang? This is a questionnaire that we use for people who have not been diagnosed of obstructive sleep apnea but have concerning symptoms like I listed earlier: snoring, daytime sleepiness, early morning headaches. Someone has seen that you stop breathing at some point or the other. If you already have a diagnosis of sleep apnea, you do not need to get this questionnaire done. But if you're worried about your risk of sleep apnea, then this is a good tool for you to use. We also recommend stop bang questionnaire if you're going in for a surgery and you have symptoms of sleep apnea. It is crucial for you to get tested for sleep apnea if you have concerning symptoms prior to going in for a procedure. I recently had a patient who was referred to me because this patient went in for colonoscopy and after light sedation went into respiratory distress, and that procedure had to be aborted. And so making sure before you go into especially major surgeries like knee replacement surgeries or what have you, making sure that these symptoms are evaluated and you're tested for sleep apnea would be what you want to do.